Joining us to talk more about this and how the U.S. foreign aid, and specifically food aid, is being cut back is Christopher Palmedo. He is a clinical professor at the City University of New York's Graduate School of Public Health and Health Policy. Christopher, thanks very much for coming on the program.
Hi, Sean. It's good to be here.
You know, this is just simply not a good image for the United States. Talk about the way this is being viewed and this shift toward defense and really the way that the Trump administration destroyed this 500 tons of emergency food aid and 9.7 million in contraceptives as well. Why was this done?
Well, it's politics, I think you could say. And so the question of how deep you want to get, I mean, it's important to understand these policies come from politics. Many people voted for Trump out of a place of fear or anger. People were losing their jobs, their livelihoods. They felt left out of the U.S. economy. The Democratic Party, who was in charge, was not offering them anything. The Democratic Party seemed more interested in marginalized populations and international aid programs than they did the lives of Americans. And Trump spoke directly to these people. He promised to put America first. And the Democratic Party, to these just large voting bloc, was represented by college-educated elites who looked down at the working class. They worked for these elites worked for NGOs. They found new ways to feed poor people in other countries. So this is what elected Trump president, and he's fulfilling the promises that he gave. Now, that's the reality. Whether you agree or disagree is another story.
Okay, let's talk about the financial savings compared to the humanitarian aspect of all this. Public health losses such as preventable deaths and diseases. I'm not talking about getting rid of USAID at the moment. I'm talking about all this food that's available and could have gone to people very easily.
Absolutely. I mean, the reality is that people will have suffered from this. People are starving all over the country and all over the world. And this emergency relief could have helped those folks. And look at just contraceptives alone. The Good Micro-Institute analysis estimated that a 10% decline in contraceptive use in low-income countries can lead to 15 million more unintended pregnancies. That would increase poverty. That would lead to more unsafe abortions. That would lead to maternal deaths. So that's contraceptives alone. This big package that was canceled was food and contraceptives. Right. And both will have led to human suffering.
You know, Trump has been so active during his first 6 months, and he ran on so many issues. And clearly the economy, tariffs, immigration are getting many of the headlines in the United States. So something as significant as what we're talking about simply hasn't got the attention one could argue that it deserves. USAID being shut down. I worked in Afghanistan for a year right next to USAID, and a lot of money was wasted there. I don't think anybody's going to say that. But by USAID, to see those folks go out and work every day to deal with preventable diseases, deaths, and things of that nature, it's difficult for people in that environment to come back and say, well, shutting USAID down makes sense because it does limit government.
Of course it's difficult for people who are doing this work to hear that. I mean, and you know, what they have done is probably a more effective and efficient way of saving them lives than you could do in this country because there were so many more lives that needed to be saved. I mean, according to the British medical research journal, The Lancet, as many as 14 million people will die between now and 2030 as a result of these cuts, specifically USAID. More than 4 million children under age 5 will be projected to die as a result of these cuts. Cuts to the HIV/AIDS program called HIV/AIDS called PEPFAR. That's estimated to result in 3 million more deaths between now and 2030. Malaria deaths can run in the hundreds of thousands. Tuberculosis. But look, public health is about prevention. Right. And prevention doesn't make headlines. It's not as dramatic as the surgeon who saves a baby on the operating table or the firefighter who pulls a child from a burning building, right? But, you know, here's the truth. Public health saves more lives by stopping those fires before they start, preventing the disease before it spreads. It takes a lot of work to create a non-event.
Yeah, Christopher, I think you really hit the nail on the head in why this
Yeah.
isn't getting the attention that perhaps it deserves. So let's, as an educator, let's move forward. What is it going to take to really hit a nerve with people? Because this is something in a far off place. This is something that allegedly doesn't affect every American day in and day out.
Well, as your previous segment discussed, presidential administrations don't last forever. So we can look forward to an administration that will take this up again. If and when the government's ready to investigate in international aid programs, we can do better than we used to. As you said, improvements could have been made, and they probably were not made as quickly as they were. I study this. We have the International Center
Right.
on Immigrant and Refugee Health, and we're a public health school. But my father ran a program when I was a child. He ran a company that also did this work all around the world, and I saw the stories. But I also understood over these years that a lot of efficiencies could have been done. There was hubris on the part of the people in charge. And so, if we're ready, and when we hopefully will be ready to invest again in international aid programs, we can do better than we used to. A greater culture of improvement and innovation should have been there in the first place, and that's one reason the cuts were so ruthless. So one way to get better is by diversifying our workforce. We need to diversify our international assistance corps in terms of race, ethnicity, income, but also politics. Republicans and Democrats can work together to help the U.S. build a world assistance program that includes three important areas, like three interdependent legs on a stool: humanitarianism, economic opportunity, cultural bridge building, and addressing all these issues as well as we can using the innovation will help the U.S. again be seen as an ally around the world. And that seems to me to be a win-win for everybody. But it's still a hard sell in the U.S. right now.